unabashed,
the most unpredictable,
becomes a headline,
the most volatile,
outrageous behavior,
unsubstantiated narratives, a battle of personalities.
Welcome to Grant Tamasha, a co-production of the Carnegie Endowment for International Peace and the Hindustan Times. I'm your host, Milan. There is hardly a day that goes by that the subject of India's demographics is not front and center in the news. Whether it is India surpassing China as the world's most populous country, questions about how the Indian economy can provide enough jobs for a growing workforce, or how population should be used to allocate everything from legislative seats to fiscal transfers, demographics are at the heart of many debates concerning India's political economy. To talk about India's demographics and its demographic transition, I'm joined on the show this week by Poonam Muttreja, who serves as the executive director of the Population Foundation of India. For over 40 years, she has been an advocate for women's health, reproductive and sexual rights, and rural livelihoods. Before joining PFI, she served as the India country director for the MacArthur Foundation for 15 years. I'm pleased to welcome her to the show for the very first time. Poonam, good to talk to you.
Thank you. Good to be here.
So I want to start this conversation by referring to a piece that you recently co-authored, and the title of that piece was Busting Myths About India's Population Growth. And in that piece, you and your co-authors wrote the following, and I just want to read out a bit of what you wrote. India's population has long been a subject rife with myths and misinformation, often exacerbated by a global narrative that pits growing numbers against limited resources. This narrative, bolstered by India's recent overtaking of China as the world's most populous country, has led to the widespread belief that India's burgeoning population is at the root of several pressing global issues, from resource scarcity to climate change, end quote. Let's maybe begin with the global narrative and the misinformation. We're going to come to the facts in a second, but just how would you characterize the myth around India's population growth?
So there is nothing, no other issue where I find more myths and misconceptions, not only today, but over the last several decades. So in this article, we dealt with three common myths that continue to dominate and influence public opinion. The first is that India's rapidly growing population is threatening the country's economic stability and environment sustainability, of course. And globally, there's more stress on environmental sustainability. And nationally, there is more stress on economic stability. So this fear stems from a historical narrative of unchecked population growth, but the reality is quite different today. So India's fertility has been steadily declining over the past few decades. Now it stands at 2, which is below the replacement level of 2.1. So, and this decline reflects a significant shift in size preferences across India, even in traditionally high fertility regions, not just in low fertility regions. The second misconception, the misconception of overpopulation or population explosion, also continues to persist despite India having achieved a replacement level. So going forward, the focus could now shift on managing demographic transitions. The second myth is that certain religious groups, particularly Muslims, have much higher fertility rates, contributing disproportionately to population growth. Yes, it is true that Muslims have a higher fertility rate than other religious groups. For example, in 2019-21, the total fertility rate among Muslims was 2.4, while it was 1.91 or 1.91 for both the Hindus and Christians, and lowest, of course, among Sikhs, which was 1.6. But at the same time, there are three facts to be noted to bust these myths. One, while the fertility rate among Muslims is slightly higher than among Hindus, the gap is closing very rapidly. 2, the fertility rates among Muslims have declined more sharply than amongst Hindus. 3, religion is not a significant determinant of fertility rates. Hindu women in Uttar Pradesh, for instance, and Bihar have more children than Muslim women in Kerala and Tamil Nadu. Socioeconomic backwardness and not so much religious affiliation explains the differentials in fertility rates. So the mantra is quite simple to deal with these myths. Take care of people and population will take care of itself. When I say take care of people, and especially women, I mean ensure that they get proper education, they are well nourished, they have access to affordable health care, and they earn decent incomes.
So you've raised a lot of issues, and I want to spend the remaining time we have delving into each of them. Let me start first with the overall fertility rate. What demographers say is that for a population to remain stable, India requires a total fertility rate of around 2.1 children per woman. That's something known as the replacement level, as you pointed out. And when in any country the fertility rate falls below the replacement level, populations begin to shrink. And as you said, the fertility rate in India is around 2.0, just around or just below the replacement rate. Tell us a little bit about the repercussions of this, right? Can we judge this as a positive thing, as a negative development? How do we think about this decline?
So as of 2024, I believe we stand at a pivotal moment in India in our demographic journey. There's the issue of India surpassing China, and that's why I mentioned 2024, making India the most populous country in the world. There is good news on the population front, as we discussed earlier, with population rates slowing down, driven by a sharp decline. While the current fertility rate of 2.1 is below the replacement level, as you said, indicating India's on the path to stabilization. Only a few states such as Bihar, Uttar Pradesh continue to have fertility rates above the replacement level. States like Kerala and Tamil Nadu have significantly lower TFRs, often below 1.8, which marks a significant shift from a few decades ago about uncontrolled population growth. They are much of the past there and being more pressing. We need to contend with 3 macro realities. One, despite the total fertility rate falling below the replacement rate, India's population will continue to grow for more than a few decades and is expected to plateau around 2045, 2050. This is because the population momentum, which refers to the continued increase in absolute population size due to a large cohort of young people in the reproductive age group, will keep this demographic transition continuing in India. And the demographic transition provides both opportunities and challenges. The challenge is to provide good quality healthcare, as well as education to the entire population. So only a healthy, well-nourished, and educated population can contribute to economic growth. And an equally serious challenge is to create decent jobs for the population. Second, while the younger population presents a demographic dividend that can fuel economic growth, the aging population, and especially if we look at the state of Kerala and Tamil Nadu, where the TFR is well below replacement rate at 2.1, the government needs to invest in healthcare, social security, infrastructure to manage the transition to an older society.
So Despite everything that you said, Poonam, which is that, India has experienced a declining fertility.
Mm-hmm.
There are differences across religions, though they are shrinking. There are differences across states, for instance, between poorer northern states and richer southern states. Those differences are shrinking.
Mm-hmm.
But yet there still seems to be, especially among the political class and the political elites, a feeling that something must be done on population. As you've noted in some of your writing, there have been several private members' bills introduced in Parliament that propose pretty stringent population control measures, such as enforcing a two-child limit. We know that some Indian states have already passed this kind of legislation.
Yeah.
In your opinion, do these policies do more harm than good?
So, it's really incredible whether when we are talking about the myths and misconceptions, or we are talking about these two-child proposals and the private members' bills, expectedly educated members of parliament, at least majority do have education. It's amazing that in spite of a country with rich demographic data, they don't seem to make data-based analysis or statements. So that's why we've had several private members' bills, as you said, which have proposed stringent population control measures, including enforcement of a two-child limit. Some Indian states, like Assam, for instance, have even introduced policies that incentivize families to have fewer children, offering benefits, subsidies, and disincentivizing larger families by restricting, their access to certain health services and so on. So while these policies may appear to be solutions to curb population growth, they are likely to cause more harm, in my opinion, and global evidence shows, than good. So, coercive measures often target the most marginalized sections of society: women, the poor, religious minorities, and so on. So, such policies, I believe, disproportionately affect women by imposing penalties on family size, which can result in them being denied government services or even job opportunities. So this reinforces gender inequities and restricts reproductive rights. There was a 5-state study you may have heard of by Nirmala Butch, a former senior administrative service officer, who found when they had reservations two-child bill passed for panchayats in 12 states across India, only at the panchayat level, they found that instead, in these states, they found that having adopted a two-child policy at the panchayat level, there was a rise in sex-selective and unsafe abortions. Men even divorced their wives on paper to run for local body elections. And maybe for some, it was an opportunity to truly do that, give a divorce, and not just on paper. And families gave up children for adoption to avoid disqualification. If we saw this at the panchayat level, can you imagine if we did this at a national level in a country which has son preference, which would like to have two sons, ideally, if they had two children, and definitely the first child to be a son? And moreover, international experience shows that coercive population control measures rarely achieve their intended goals and can lead to unintended social consequences. And China is a big example. China's one-child policy, for instance, has created a demographic crisis, adverse sex ratios. And I believe rather than focusing on punitive measures, what is needed is a rights-based approach that emphasizes education, healthcare, access to voluntary family planning. And India has, I must say, on the whole, successfully reduced its fertility rates without coercion. And a focus on women's empowerment, increasing access to reproductive health care, has proven to be the effective and humane way. Finally, coercive policies risk undermining the significant progress India has already made in achieving population stabilization.
Are you curious about India's economy, politics, culture, and history, and hungry for rigorous analysis of its most pressing challenges? Tune in to Ideas of India, the podcast that's becoming the go-to source for smart thinking on Indian political economy. Hosted by Shruti Rajagopalan, Senior Research Fellow at the Mercatus Center at George Mason University. You can hear from top experts in economics, law, and social sciences such as Montek Singh Ahluwalia, Anne Kruger, Arvind Panagriya, and many others. Explore cutting-edge ideas shaping India's political economy from young academic scholars, and connect with a community of forward-thinking intellectuals. Ideas of India offers invaluable insights for anyone invested in India's progress. Subscribe now to Ideas of India and be part of the conversations driving India's future. New episodes are released every 2 weeks and are available on all major podcasting platforms. Transcripts of each conversation are also available at mercatus.org/Ideas of India. We touched upon this a few different times, but I want you to just maybe elaborate a little bit on something you said earlier. There was a working paper that was published by the Prime Minister's Economic Advisory Council. It was titled, somewhat innocuously, Share of Religious Minorities, a Cross-Country Analysis. It came out, I think, just ahead of the elections in spring 2024. And one of the headline findings of that paper, and it was reported throughout the press as well, is that between 1950 and the year 2015, there was a decline of 7.8% in the share of the Hindu population and an increase of 43.2% in the share of the Muslim population. You and a colleague wrote an op-ed in The Hindu, the newspaper, and we'll link to that in our show notes, in which you said that the paper and some of the reporting done by the media on the paper inaccurately tried to create an impression that the Muslim population in India is growing rapidly and that this threatens the Hindu population. Tell us a little bit more about the paper and the objections you had to it.
Okay, so we raised concerns about the interpretations of the data and especially in the media and by some politicians of this working paper whose framing of demographic composition of India's population caused controversy. One, these interpretations suggested that Muslim population in India is growing at a rapid rate, creating an impression of demographic threat to the Hindu majority. You know, the way it was interpreted by some media in the first 2 hours of the paper being released was that the Muslim population was more than 43% and increasing and will cross 50%, and the majority will become minority and the minority will become majority. This portrayal is not only misleading, the portrayal of the numbers, but dangerous as it feeds into communal, as you know, anxieties and strokes, fear. And we have seen that using these numbers and insinuations. We've seen this in the past, in the middle of a very strict, a time in the middle of elections where there's already a lot of conversation, which is very communal. There are communal anxieties happening. So that's one. The reality, as evidenced by multiple demographic surveys and data by the government itself, is that fertility rates among Muslims are declining faster than those of Hindus. And the growth rate gap between the two communities has been narrowing over the past few decades. What we argued is that this narrative of a Muslim population boom is not grounded in factual data, but in attempts to create political and social divisions. Even the working paper actually acknowledges that it did not contextualize the role of socioeconomic factors in fertility patterns, particularly how poverty, access to healthcare, and education impacts family size. While they acknowledged it, but that is something that any academic or any document should have dealt with. It's also crucial that we move away from such communalized discussion of population growth and focus on improving access to resources for the community. Population stabilization is happening across religious lines, and the emphasis should be on ensuring equitable development for all. So, given that we saw the media getting capturing the wrong insinuations, we did respond strongly. But also, we pointed out, as I said earlier, the nature of the paper, where, as I said earlier, you can acknowledge you haven't contextualized, but you have to if you're raising such crucial data.
You know, we've been talking a lot about fertility decline and a population that is slowly but gradually getting older. And one of the things that you pointed out earlier is, you know, the country is going to have to grapple with the realities of an aging society. Certainly not as soon as, say, a country like Japan or most of Western Europe or even the United States. But there are certain burdens that are going to be placed on India over time as the median age increases, and there are more and more people, tens if not hundreds of millions of people, past the retirement age and so on. Do you see that sort of planning taking place? The idea that there needs to be investments in a certain kind of healthcare infrastructure to take care of an aging population. We need to have labor being directed to, those kinds of fields. I mean, do you think that those preparations are underway, or do you think that that's too premature given that, the median age is still around 28 or 29?
No, I believe it is not premature. But the answer to your question is we are not preparing. And the reason I say it's not premature is because by 2050, the proportion of elderly in India is projected to rise to nearly 20% of the population, up from around 10%, which is today's data. This shift will place enormous pressures on India's healthcare and social security systems. The country needs to address the growing needs of the elderly care, including long-term healthcare services and pension systems, and plan for it. Currently, social protection for the elderly is really low and weak, and the lack of comprehensive national strategy could leave millions of elderly citizens vulnerable to poverty and neglect. So the time is now. And actually, the only state that has begun to think about and plan, as well as there's some implementation in the healthcare, is Kerala, where they've started special healthcare strategies and services for the elderly. But with that exception, I'm afraid in the country, it's not even an issue, even though the demographics are staring at us. And some countries have attempted to reverse aging trends by offering incentives for families to have more children, but this is not a feasible long-term solution India or any country should consider. So, encouraging lifelong learning and reskilling programs will also help keep older workers employed, and policies to promote intergeneration support systems. See, basically in India, we need to, instead of counting numbers only, we need to start counting on them, including the elderly. But India has very little time to lose, is what I would say.
So you said something very interesting. You said that schemes that would provide incentives to households or to families to have more children as a way of kind of boosting, younger demographics is not something that should be pursued in India or anywhere else. Why do you think that that's a kind of a misguided or incorrect approach?
Okay, so if you look at global trends, once fertility starts to decline, it declines at a faster pace than the previous years. And we can say that for not only population as a whole, but even certain demographics, like the Muslim example, where their population, once it began to decrease, it decreased at a very rapid rate. And if you look at countries like Russia, you look at Korea and Japan, they have been giving incentives, but the population is declining even more rapidly. Women are not, uh, uh, we can't switch on and off buttons in them. Once they reach a stage where they've decided number of children they have, whether it's because of education or access or healthcare services being available, they don't have more children because the country decides now they need more children, now they need less children. It is so disrespectful for women, and women are not accepting it anywhere in the world where incentives do exist. And finally, we have to plan for our numbers and provide the services and so on. Incentives have not led to people having more children anywhere in the world.
So I want to kind of switch topics a little bit to talking about men, because that's something that I think is often not talked about enough in this discussion. In about a year ago, in July 2023, you had a column in the Hindustan Times in which you and your colleague noted that more than half a century ago, male sterilization was the dominant method of sterilization in India. And you had some very interesting data. You say that 80.5% of sterilizations that were conducted in the late 1960s were vasectomies conducted on men. And if you fast forward to 2021, male participation in family planning dropped to 0.3% when you look across all family planning methods. Tell us what accounts for that stark decline. Is this something that we ascribe to forced sterilizations during the time of the emergency, or is there something larger going on?
Yeah. So first I want to say, Milan, that either there was a typo in that article, which I don't believe we would have let it go, or there's a problem here. It is women. There was, the burden of. Okay, let me step back. The male and participation in sterilization was much higher in up to the 70s. It was close to 30% of the sterilization, and female was close to 70%. And but the burden of family planning has historically been on women, whether it's sterilization or other methods, which is reflected in male participation in contracepting being alarmingly low, even condoms, etc. So as of 2021, male sterilization has accounted for only 0.3% of all family planning methods, down from over 30% in the 1970s, which we just mentioned earlier. The decline is partly a legacy absolutely of the emergency period when a large percentage of men were forcibly sterilized as part of a government-led population control campaign, as you know. The trauma of these forced sterilizations left a lasting stigma on male sterilization. And, we reached a stage, even if when men wanted to get sterilized, politically, the politicians were scared to even talk about male sterilization, but we continue to talk about female sterilization and do female sterilization. So the patriarchal norms come out here and the gender divide. But the primary reason behind, I believe, low male engagement in family planning can be attributed to the prevalent myths around how vasectomies reduce virility and libido. So the lack of male participation is also reinforced, in addition, by patriarchal norms that view contraception and reproductive health as women's domain. And what is incredible is that a large percentage of women also believe in this myth that vasectomies reduce virility and libido. So, if you ask the women, why are you going through sterilization? Why not your husband? She'll say, wo weak ho jayenge. He will become weak. Huh? And the lack of, this mindset persists despite evidence that male involvement in family planning leads to better health outcomes for both men and women. Let me give you two numbers that are really shocking, huh? So condom use in India, as I said, is also extremely low, less than 10%, according to NFHS 1921. Indian men simply do not want to use condoms. The women needs to protect herself from unwanted pregnancies. But it is her business, not the man's business. I sometimes say for men, it's intercourse often for men is about sex, but for women, the burden of getting pregnant. It is her business, not the man's at all. And second, estimates suggest there are close to 16 million abortions every year, half of them due to unwanted pregnancies. So to understand the significance of these more than 16 million, because women don't acknowledge always on very private issues and abortion has stigma. So even if we say 16 million abortions, we need to juxtapose it against the number of babies born every year. So roughly 23 million babies are born every year because men are not really collaborating on contraception, not only using it themselves, but also have not been very engaged, supportive to women who don't have the agency for whatever reason or access to family planning services. And, and to make things worse, between 2007 and 11, 67% of the abortions in India were classified as unsafe. So when I raised the gender issues and the issue of patriarchy and the issue of neglect of women, all this data tells us, captures everything.
Hey, Grant the Masha listeners. Thanks for listening to the podcast. Putting this show together each week is a labor of love, but it takes a lot of work to put out a great show every week. If you'd like to support the work we do at Grant the Masha, please visit ceip.org/donate. Don't forget to subscribe to us on Apple Podcasts, Google Podcasts, Spotify, or on your favorite podcasting platform, so you'll be the first to know when a new episode rolls out. So, you said something just now that I wanted to just ask you to kind of expand upon. You just said that all the research studies show that male involvement in family planning leads to better health outcomes, not just for men, but for women as well. Explain to us the link here.
Yeah. So first, let me deal with vasectomy and tubectomy. A woman has to go through anesthesia. A woman has to go through being stitched, lots of part of the procedure which is risky under the conditions in which much of our healthcare services are provided. While it's very simple for the male to get a vasectomy, it's a 10-minute job, it's reversible, their tubes can be tied and untied again. While in the case of a woman, it's permanent. God forbid, two of her children die, or one child dies, she wishes to have more children, or the family wants more children, they can't. Let me get to other aspects. So, couples that decide and collaborate on thinking through their families are also provide opportunities for women and men to have conversations, greater collective decision making. And that doesn't happen only in one situation, it spills over in other areas of their family life. Third, the risk of abortion can be greatly reduced if men participate. I am not talking only about a man going through a sterilization or using condom. I'm talking about them also being supportive husbands. And participants. And finally, the abortion-related morbidity and sterilization-related morbidity, we haven't measured, but we see plenty of it. We haven't measured enough. So women will be healthier if they have less abortions. Abortion-related morbidity often is even worse than sterilization-related morbidity. I say some women die and some women live dying. It's extreme. And for example, I want to give you an unmarried one study of an unmarried abortion seekers found that as many as a quarter of them had delayed their abortion into the second trimester of pregnancy. And this goes for married women also, many fearing disclosure, with the result that either they can't end up getting an abortion, and if they do get an abortion at a much later stage, it's risky for their health.
Right. I mean, this kind of leads me to just something that you've also written on that prompted a question for me, which is, it's been shown in many studies that there is a significant association between years of schooling and total unmet needs for family planning and unmet needs for spacing. And you point out that this demand for unmet needs is the highest among Indian women who are aged between 15 and 24. Just help unpack that for us. When we talk about unmet, quote unquote, needs for family planning and spacing, what are we talking about? And number two, why are the numbers so high for women in this age category?
Mm-hmm. So, unmet needs for family planning refers to the gap between women's desire to avoid or delay pregnancy and their ability to access contraception suitable for their needs. In India, despite the progress in expanding family planning programs, services, even today, 9% women of married women still have unmet need for family planning, which is 9 million in terms of babies born because they have an unmet need. Why do the younger, why is it more pronounced among young women aged 15-24 is often due to not only lack of access to contraception, but limited agency in reproductive decision making and socioeconomic barriers that go with it. The highest level of unmet need is found among young and low levels of education, and those from marginalized communities. Young, if you go to an ASHA or a frontline health worker or even a doctor, there is this norm, social norm, that a girl must demonstrate her ability to be fertile as soon as she gets married, regardless of the age of marriage. I have spoken to Ashas across the country who say they would never suggest family planning or an abortion for either a married or an unmarried young girl. So it is about social norms. It's about less agency. It's about the reluctance of the public health system and often private sector too, judgmental about these issues, and they are dominated by the same social norms. And I also believe that this high unmet need for family planning highlights the need for more comprehensive and accessible reproductive healthcare services and empowering women to exercise agency. And in addressing this issue will require um, all of this, including empowerment of women and more reproductive choices. And we need programs to target young women, as I said, who don't have agency, especially those in rural and underserved areas.
So maybe this is a good way to kind of wrap up this conversation, because you've said today in this conversation, but also written in print, that, India's expanded family planning programs have shown many positive results, right? And I think the proof is certainly in the data when you look at fertility and so on. But you've also noted that we need to have more targeted social, more targeted behavioral change communication strategies to try and get at this issue of social norms, to try and address social norms that constrain women's agency, constrain their reproductive autonomy. At a macro level, tell us a little bit about what's working in family planning efforts today in India, and what do you think is the final frontier, right? What are the changes or adjustments you'd like to see made going forward?
So India's family planning programs have made, I believe, significant progress in expanding access to contraceptives and reducing fertility rates. I particularly want to mention first a government initiative, Mission Parivar Vikas, which focuses on high fertility districts. It started with 146 high fertility districts in the north where, the fertility rates were pretty stubborn. And they've been successful in increasing the use of modern contraceptives in these districts. And now it's expanded to Northeast and other states or pockets in India where fertility rates are high and there's an unmet need. The government has also introduced a wider range of long-acting reversible contraceptive options in the recent years, which some of us have been advocating for years. And again, it was myths, misconception, lack of gathering and keeping up with the scientific data in other countries where injectables and implants were being used. And this greatly caters to the diverse needs of women. These efforts have led to a reduction in unmet need for family planning, as well as improvements in reproductive health outcomes. The whole focus on doing camps for sterilization for women, where they would have to wait till a certain period where government decides there will be camps. It could be 8 months, it could be 6 months. And women end up getting pregnant with just one sexual encounter. So, women needed to have fixed day services available in facilities. And some of us advocated, campaigned for years, and that has also happened. Now we have fixed day services. However, there is enormous room for improvement, particularly in addressing the social and cultural barriers that limit women's reproductive autonomy. And more targeted social and behavior change communication, certainly, as you raised, strategies are needed to challenge patriarchal norms and empower women to make independent decisions about their family planning. The budget for family planning needs to be increased for meeting the unmet needs. Do you know that in India, only 6% of our meager health budget is for family planning, of which barely 0.6% is for temporary methods in a country where we have a large youth population which has need not for family planning but temporary methods. Additionally, the government really needs to increase not only investments in temporary methods and family planning services, but focus even more in the underserved regions to meet the reproductive health needs of India's large young population. And finally, changing this requires concerted efforts through education, behavior change communication, challenging social norms, policy interventions to challenge these deep-rooted beliefs and encourage men to take more responsibility in reproductive health decisions and become supportive partners. I always say, Desh badlega jab mard badlega. In fact, we are just launching a campaign which means the country will change when men change. And it's not just about contraception. It's about being supportive partners in caregiving and in caregiving of the children, doing collaborative decisions, sharing household work, etc. So we really need to change our men and their behaviors, which will be a huge contribution if we were able to do that. And I do believe we will be able to if we work on it.
My guest on the show this week is Poonam Muttreja. She's the executive director of the Population Foundation of India. She's previously served as the India country director of the John D. and Catherine T. MacArthur Foundation. She's also co-founded and led the Ashoka Foundation, Dastkar, and the Society for Rural, Urban, and Tribal Initiative. Poonam, thank you so much for taking the time and coming on the show today.
Pleasure. I enjoyed it. Thank you.
Grand Tamasha is a co-production of the Carnegie Endowment for International Peace and the Hindustan Times. This podcast is an HT Smartcast original and is available on htsmartcast.com. You can also find us on Apple Podcasts, Spotify, or wherever you get your podcasts. Don't forget to rate and review. It helps others find the show more easily. For more information about the show, to support the work we do on Grand Tamasha, and to find the writing we mentioned on this week's episode, visit our website, grandtamasha.com. Tim Martin is our audio engineer. Mira Verghese is our executive producer. Additional assistance is provided by Annabelle Richter. Thanks for listening, and see you next week.
This was a Hindustan Times production brought to you by HT Smartcast.
HT Smartcast.